Hello and welcome to this presentation for the employees of KPG Healthcare for the Employee Benefits Program beginning January 1st, 2023. My name is Bill Hammett, happy and honored to be your insurance expert. My contact information is on the screen there if you need help through the open enrollment process. Happy to be here for you, happy to help. If any of you have questions or have needs or have claims issues or need finding doctors or anything that goes on throughout the year, our account manager, Rhiannon, or benefit administrator, Anna Navarez, is available for you. We're happy to help, and we're here to help. Quick timeline, quick agenda. We'll go through the timeline of open enrollment, the medical plans available, dental and vision plans, some screenshots on how you enroll. There will be some changes to that this year. That's the biggest difference. And then, of course, if you have questions or need answers, we're here to help. Open enrollment is November 14th through Wednesday, November 23rd. This is when you are eligible to enroll in benefits. If you are waiving benefits year after year or you know you don't want it, you are still being asked to log in and waive these benefits. It is mandatory that everybody who is eligible log in and do something. Even if you are just keeping benefits as they are currently, it's important that you log into the system and make those elections or make those declinations. This is also your time to change plans. If maybe last year you bought a plan with a higher deductible and you want to move to the lower deductible plan, this is your year. If you wanted to add dental or remove dental, this is the time to do it. Any changes you make will be effective January 1st, 2023. And again, asking everybody to complete this task no later than Wednesday, November 23rd. We have 3 to 5 medical plans available depending on where you're at. We have the 2 HMO plans that are available for California employees. So if you are living and working in California, you are eligible to join one of the HMO plans from the Harmony Network of United Healthcare. HMO plans are going to be smaller network of providers, but lower costs and more copays associated with it. For those of you that are outside of California, you have the 3 PPO options. There's a $500 deductible, a $1,500 deductible, and $3,500 deductible PPO plan. The 500 is highlighted because last year this was a $250 deductible. We've changed that a little bit due to price increases. So please note that those are our 3 plans for those of you that are outside of California. If you are inside of California, you have all 5 available to you. So here are our California HMO plans. Again, we've got our deductible is $500, out of pocket is $4,000 for an individual. The lower cost plan is $2,500 deductible, $6,000 out of pocket. And what this out of pocket maximum means is if you get down here to hospitalization and surgery and emergency room and all that kind of stuff, you'll see that there's percentages. This means that you will be asked to pay 100% of your deductible, so $500 or $2,500. And then after you meet your deductible, you'll be asked to pay 30%. United Healthcare will pay 70% until you have spent out of your pocket the maximum amount of $4,000 for this high option plan or $6,000 for the low option plan. Once you get to these numbers, you will pay nothing else for the rest of the calendar year. So that's important to note. Also note there's different copays for PCP, primary care physician versus specialists. Copays there, lab and x-ray have copays, MRIs have copays. So lots of copays with these HMO plans all the way down to your prescription drugs here at the bottom. So if you are in California, you're eligible for these plans. For those of you that are not in California, or if you are in California but desire choice and freedom of movement, we've got our 3 PPO plans. The high option PPO plan with a low deductible of $500. Again, for those of you that are on this plan now, this is an increase from the $250 deductible last year and $4,500 out-of-pocket maximum. You'll see these numbers are split between individual and family. So if you have a family, your out-of-pocket maximum could be $9,000, $10,000, or $14,000. But please understand that no one person in the family unit would be on the hook for any more than their individual out-of-pocket maximum. So if this is me, if I'm on this $1,500 PPO plan here and I have a $100,000 hospital stay issue, I would pay 100% of my $1,500 deductible, then 30% of the cost. United Healthcare pays 70%, not to exceed $5,000 for myself and then I'm covered 100% for the rest of the year. My family would have the other $1,500 in deductibles and the other $5,000 in out-of-pocket maximums. So this protects both the individual and the family from major catastrophic claims. We see our office visits have copays for primary doctors versus specialists. Urgent care has copays. Prescription drugs have copays. So when you're looking at these plans, you'll see that the high option plan is more expensive than the mid option, and the mid option is more expensive than the low option. The biggest difference here is how are you using your plans? How comfortable are you with risk? If you're comfortable with a $3,500 deductible, meaning if you end up in the hospital or you need complex imaging and stuff like that, you're going to pay 100% of the cost up to the deductible. If you're comfortable with that because maybe you don't utilize a lot of healthcare, then this is a great buy up here, this low option plan. But let's say you're having a baby, or you're getting knee surgery, or you go to the emergency room a lot. I would suggest that you look at the high option plan, because this low deductible of $500 is going to protect you from being out of pocket $1,500 or $3,500 right up front. So it's a nice benefit there. Also, you notice the percentages, the co-insurance they call this, is lower with the high option plan. So more expensive, but if you're using your plan, it could wind up being a better value for you, since the money that you're paying for the premium on a paycheck per paycheck basis is all tax-free, whereas all of these dollars, these deductibles and out-of-pockets and copays, these are all after-tax dollars. So if you know you're using your health plan, look towards the high option or even the mid-option plan. But for those of you that don't really use your health plan other than a couple of doctor visits and maybe a generic drug here and there, this low option plan would be plenty for you. So dental plans, we also offer this through United Healthcare. California employees have the HMO dental plan. This is going to be super low cost, but again, a lot less choice of providers. Everything's a copay with HMO dental plans, low cost, less choice, but really great for those of you that are in California that just want a couple of free cleanings, and that's all you really need. So this is a good option for you here. For everybody, including California employees, we have our PPO dental plan. The PPO dental plan is a much larger network of providers. It's a national network, so you can be anywhere in the country and have access to in-network PPO dentists for preventative stuff like cleanings and the preventative x-rays. It's 100% covered. Basic services such as endodontics, periodontics, this would be root canals, this would be deep cleaning. They cover 80%, which means you pay 20%. For major services such as inlays, crowns, dentures, all these kind of things, it'll be a 50-50 split. There is a $50 deductible per person, no more than 3 of those in a family. And you have a calendar year maximum of $2,000. This means that once the insurance company, United Healthcare in this situation, has paid out $2,000 in benefits, they will no longer pay any more, and you will pay everything else. So you still get the discounts of being part of the PPO network. So you still get discounted rates off of the cash price, but $2,000 is the most they would pay when it comes to the basic, major, and preventative services. A note that the out-of-network benefits. So if you go to a dentist that does not accept the PPO network, this plan is very good in that it pays for 90% of what is deemed to be usual and customary. When it comes to dental plans, this is a very good benefit. This means that they're paying 90% of the cost that the dental industry determines to be a usual and customary charge for that service. This is a good thing. This means your benefits will go a little bit further. However, I do encourage everybody to find an in-network PPO dentist, because your dollars will stretch a lot further for that. Last note about PPO dental plans. When you are calling a dental office and asking them if you can go there with United Healthcare, you need to make sure you are saying, are you an in-network provider for United Healthcare PPO dental? If you say, are you an in-network provider, that is distinguishing that they are a PPO dentist, meaning that they are contractually obligated to give you the lower discounted rates and not bill you the difference. If you say to a dentist office, do you take United Healthcare PPO dental? They will all say yes. Taking it does not mean they are an in-network provider for. Taking it just means they'll take whatever United Healthcare pays and they're going to charge you the rest. So make sure you ask that particular question. We have a vision plan available also through United Healthcare, so nice and easy, all in one spot here. We have an annual copay of $10, so you get an exam every year. Annual $25 copay for new lenses. Same thing with contacts instead of glasses, you get $25 copay for that. And if you're getting glasses with the frames, you have a $180 allowance on an annual basis for that benefit. So this is a good vision plan. Lots of good benefits here. So please, if you have need for these services, please enroll in this. It's a very inexpensive benefit and can take care of you pretty well, because the premiums, again, are tax-free. But in exchange for that, you're going to get to spend very low copays for things like exams and lenses, and you'll have $180 credit towards frames that you might want to get. So just a quick note on the online access for United Healthcare, as well as their app. You can download the United Healthcare app in the App Store, whether you're using iPhone or Android. You can scan this QR code here and go right to myuhc.com and register. If you are a United Healthcare member, I strongly recommend that you do this. You can access your claims online, you can access your benefits, you can find doctors, you can interact with providers, you can do a lot of things with by registering for the your online account, as well as downloading that smartphone app, so that things like your ID card, which we all lose very frequently, is never out of your pocket because it's always on your phone. So how do we enroll? So we're doing things a little differently this year. We've used a certain enrollment process before. We are moving to the iSolved payroll system. So we are integrating our enrollment with our payroll. So this should help streamline things a lot for many people, including for your employer. So it's one system. It's the same one that you use when you log in for your payroll stuff and getting your pay stubs and whatever you might be doing. You should be familiar with this. If not, it's at the employeedrive.myisolve.com. The open enrollment tab will be visible in the left menu bar. So you'll click that and you'll get into your open enrollment screen here. Once you get in there, you're going to be adding your beneficiaries and dependents. Make sure you add all of them there. Then you're going to get into, actually, this is adding your beneficiaries. You'll want to make sure that you are indicating who they are. The beneficiary portion isn't as important. That has more to do with life insurance, of which we're not offering. So just all you would do is list all this stuff. Maybe many of these people are already in the system for you, so it should be nice and easy. Once you get in there, you're going to be able to choose through the different plans that are available. Once you make all your choices, you can, once you get to there, you'll be able to see where you select the different plans. Okay, you can waive coverage. Whatever plan you want, you'll see them all there. There'll be some documents that you can download and understand the benefits a little better. Here we are again with more information. Many people are waiving this benefit. If so, you'll waive it. You'll indicate you have other coverage. Or if you're selecting coverage, you're going to be selecting for employee only, spouse, children, family. All right, you're going to see the numbers appear when you enroll. Here we are here. So then we're employee plus children. If you have multiple children and you only want to cover some of them, you would just use the check mark box here. Again, you're going to see the numbers showing up for you. Once you're all done, you're going to get to your benefit summary. It's going to give you an idea of what you enrolled in, how much it costs. You can submit your benefit elections there. Here we are getting into this where you would submit your election. So step one is you need to click this submit benefit elections here. It's going to open up a window saying that you're confirming that you want to submit these benefits. You'll click OK. Once you'll do that, you're all set. So the next step is you're ready to log into your iSolved account and you begin the enrollment process. As a reminder, the deadline to enroll is Wednesday, November 23rd. We'd like to ask for everybody to do this by then. Your HR team is going to be reaching out to all of you, encouraging you to log in and make your elections. Again, even if you are choosing not to enroll, you do need to log in and waive the benefits. Okay, everybody must log in and do something. This is a new system we're using with iSolve to enroll in benefits, so everybody's got to do something. If you have any questions, you need any answers, we'd be happy to help. Thank you for sitting through this presentation. My name is Bill Hammett. I'm honored to be your broker and happy to hear from any of you and help you in any way I can. Thank you very much and have a great day.